Most of us are aware that a stroke is a medical emergency. It generally presents with sudden numbness or weakness, especially on one side of the body. Confusion, trouble speaking, difficulty seeing in one eye, dizziness, or a loss of balance and coordination are all a few of the known symptoms of stroke. Today we're going to talk about different options you may have when it comes to stroke care. We're talking about the Comprehensive Stroke Center, a partnership between Orlando Health and the University of Florida Department of Neurosurgery. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Dr. Samuel Sapiti helps lead the Comprehensive Stroke Center at Orlando Health, and he's here to share with us the different options in stroke care. Dr. Sapiti, thanks for being with us. You are a neurologist by specialty, so kind of explain what that branch of medicine is all about.
First, thank you for having me here. It's a pleasure to be here. To answer the question, yes, a neurologist is a specialist who treats conditions in the brain. And even in that specialty, just like in medicine, you have subspecialties in different parts of the brain. So what a vascular neurologist does is deal with the blood vessels of the brain that include stroke, brain aneurysms, and things like that. Okay. That's my specialty.
So are there different kinds of strokes? Well, I think let's back up. Define a stroke, because I've heard the term brain attack, kind of like heart attack. What actually is a stroke?
Stroke essentially is any blood vessel or blood flow related condition in the brain, which it's a generic term which is used most of the time for 90% of all strokes.
90%
of all,
okay.
Correct. 9% of all strokes are when there's a blood flow compromise with a blood clot or a lack of blood flow to the brain.
So anytime there's not proper blood flow to the brain, or there is a blood vessel that bursts in the brain, anything that interrupts the flow of blood to the brain. Okay. What are the different kinds? Because all strokes are not created equal.
Correct. 90%, some say 80%, 80 to 90%, depends on which part of the world you live in, are from lack of blood supply or lack of blood flow to the brain. That's what we call stroke on the generic term. 10 to 20% of all strokes are actually bleeding in the brain. That could come from within the brain tissue, from high blood pressure, could be outside the brain tissue, on the surface of the brain, like a brain aneurysm, or an interface connection between these two areas.
So what would you call those two different kinds?
From our standpoint, we call both strokes. We call that ischemic stroke, where there's a lack of blood supply.
So ischemic is a lack of blood supply.
Correct.
Okay.
And hemorrhagic stroke is bleeding in the brain.
Okay, hemorrhage. Okay, hemorrhagic.
Brain hemorrhage. Right.
Are there some people who are more prone to having a stroke than others?
If I have to split them up together, hemorrhagic stroke can happen in any age. Kids, I've actually managed kids as young as 4 years of age with a brain aneurysm by birth.
Okay.
But ischemic stroke, on the other hand, is primarily seen in the older population, usually above 65 years of age. But in this current data that we're collecting in the last few years, we've been seeing more and more frequency of younger people in their 30s and the 40s.
How young?
The youngest person I've actually managed to treat a stroke with a lack of blood supply is in the mid-20s.
Wow. So what are the symptoms? How would you know if you're having a stroke or if someone you're with is having a stroke? What should we look for?
Stroke can present based on different parts of the brain that are affected. It can manifest in different ways and to different people in different aspects. The first thing we look for to educate everyone would be the algorithm FAST. which stands for facial asymmetry. Someone's face doesn't look the same anymore. They look droopy on one side or crooked on the other side. Weakness in the arm, that stands for A. Then speech abnormalities, slurring in your speech, unable to find words to say, or speaking gibberish. That is unusual or different from what you usually do. Are the three things we look for, and the last stands for T, which is time. And that accounts for the onset of symptoms and immediately call 911.
Okay,
and that's the factor of time.
Remember FAST.
F-A-S-T, correct.
F is for face. If you notice someone's symmetry of their face, something's wrong, something's drooping. A is for numbness.
A weakness in the arm.
In the arm. S is for a change in speech. And then T is for time. Why is time such a huge factor in helping someone recover from a stroke?
This is much more important for ischemic strokes, which is lack of blood supply to the brain. Roughly, the brain has close to 2 to 3 billion neurons or nerve cells in the brain, and for every minute of lack of blood supply, you lose 1.9 million neurons. That's a significant amount. So if you calculate that over time, in a span of 4 to 6 hours, you might lose the whole brain function of that part of the brain.
So time is of the essence.
Correct.
Why do you think people stall in terms of not getting medical help? Is it because the symptoms can be confused with something else?
Correct.
And what are they typically confused with?
The ideal way to explain that would be people seek medical attention when it's really bothering them, like pain, distress, or they're unresponsive, or they have a seizure where externally it's picked up by other people to seek medical attention. But when someone starts to speak funny or someone feels their arm is numb, it's not a painful situation for them at all. And for that purpose, they just brush it off and they don't realize that they could be having a stroke.
Okay, because pain isn't present, it's not seen as an emergency.
Correct.
Okay, so don't ignore that even if you're not hurting. Tell us about the work of the Comprehensive Stroke Center. What actually happens there?
Stroke centers are divided in two different categories. You have the primary stroke center where someone comes to the hospital seeking medical attention. Within 3 to 4.5 hours, you can actually give an IV medication called TPA, which is a clot buster, that can reverse the effects of stroke a third of the time.
Okay.
And so, but the problem with that is it's only a time limitation medication. So beyond 4 hours, 4.5 hours, if you give it, you have a higher chance of bleeding in the brain, which could be detrimental or defeats the purpose of giving the medication. That's what a primary stroke center does. What a comprehensive stroke center does is provide the next level of advanced care that includes a neuro ICU, intensive care for these patients with brain swelling, as well as surgically or endovascularly, where you put a catheter in your leg and go into the brain and mechanically pull the clot out. And you can do that up to 8 hours, sometimes as long as 24 hours, based on the location of the clot and based on the amount of blood flow that's compromised in the brain.
So again, time is a critical factor.
Absolutely.
What's the typical rehab time like? I know it's different for different people, but on average, the recovery time for a stroke?
From a stroke standpoint, the earliest measure we look for long-term recovery is 3 months. There is a score that rehabilitation doctors use, which we also use, called the modified Rankin score. For a score from 0 to 6, what that looks for is the level of functionality that's regained after a brain injury or a brain insult. And the lower the score, the better the long-term outcome. And that's measured at the earliest as 3 months. But some stroke patients can take up to 1 to 2 years to restore as much function as possible. And the measure we tell families is you look at the progression of recovery on a weekly basis or even bi-weekly or a monthly basis. And if you're showing an upward trend in terms of your recovery, your long-term outcome is much more better.
So anywhere from 3 months to 2 years.
Correct.
Okay. Can you be screened for a stroke?
For hemorrhagic stroke, it's a lot more likely.
This is the one where you have a blood
bleeding, correct,
bleeding
especially brain aneurysms. If someone has a family history of brain aneurysms, someone has a headache or a migraine, someone has an incidental nose problem, they get a CAT scan of the brain, they can find an aneurysm. So those are much more easy to be screened. Whereas ischemic strokes, on the other hand, can only be screened for high-risk population, like someone has a blood clotting abnormality, someone has inflammation of the blood vessels.
So they already know there's an issue.
Correct.
Okay. Other services offered by the Stroke Center?
We do a whole gamut of vascular. Every aspect of the brain, blood vessel abnormalities are dealt with in a comprehensive stroke center. So we manage strokes from the emergency room, from the arrival to the emergency room, all the way till the time they're ready to go to rehabilitation center.
Okay.
That includes emergent medical therapy, surgical therapy, critical care, medical care, preventative therapy.
The whole 9 yards,
Correct.
from the time they walk in the door until rehab is over.
Correct.
Okay. Are you excited about advances?
Absolutely. In the past, till late 90s, early 2000s, we only had medical therapy as an option. Then endovascular or surgical therapy, or for lack of a better term, catheter-based therapy, where we put a catheter and mechanically pull the clot out like you open a bottle of wine with a cork.
That's fascinating.
So that's been revolutionizing our field to the point that now it takes us a fourth or a fifth of the time what it used to take to access the blood clot and remove it. So we're able to restore blood flow to the brain a hell of a lot more faster than we used to do.
Thank you for being with us and for letting people know fast facial abnormalities, numbness in the arm, slurred speech, and time more than anything else. So don't wait. When we come back, we're going to meet a very special man who will tell you what it's like firsthand to have a stroke. We'll be right back. Dave Marini is here to tell us about his experience surviving a stroke. Thanks for joining us, Dave.
Thank you, Annetta.
What happened? Tell us, give us the background on where you were when you had your stroke.
Sure. Yeah, my situation was I was actually up on a roof. We were, I work for a company, we sell rooftop units, and we were up doing some training for a customer on a car dealership. And so we're up in the morning, we kind of all got together, and it was a warm August morning, so it was kind of warm out already. And we went up to do training up there, and kind of while I'm standing up on the roof, that's when I started to, you know, have symptoms.
What did that feel like? I mean, you know, often when we meet people who've had a stroke, it's kind of impolite to tell us what did it feel like, but I can do that for purposes here. What did that feel like?
It started out as an odd feeling. I think it's at first, because it was happening right at the moment, it really started to feel like almost a heat stroke. Like I was getting a little confused. I felt warm. I kind of just didn't feel right. It was hard to pinpoint, but I think, and it just kind of...
Were you dizzy? Did you have any pain?
No, no pain, no dizziness. It was more of a foggy brain, just kind of like you feel like I've been in the heat too long.
Okay.
And even though it wasn't that long, but you felt like you were. And
what was happening with you physically?
It just felt like I had to get off the roof. I said something just didn't feel right. But when I went to go reach in my pocket, and this is when I knew something was really happening, I went to get my phone out of my pocket, and I'm trying to reach in, I can't get it. And that's when I looked down and realized that my hand, my arm weren't doing anything. So it was one of these things where you don't feel it because it actually wasn't, there was no feeling to it. So
when we were talking earlier, I asked you if it was like that dream you have where you're trying to move and you can't.
Right.
And you said it was very close to that?
Yes. If you can imagine a dream where you're trying to do something and you're, like you're saying, you're trying to grab something, reach something, or do something, and your dream just never lets you do it.
Yeah.
You're right. That's a great example. You just can't do it.
Now, you said you had a colleague, so we're going to fast forward a little bit. Your colleague noticed something was wrong, called 911, and because you were on the roof, called for a fire truck too. So
yes.
By the time you got to the emergency room, you were in full-blown stroke.
Yes. In fact, while we were I was sitting on the roof. They got me in the shade over out of the way, and by that time, my arm and my leg, my whole left side, was pretty much not functioning.
Well, we're looking at you now, and you're pretty much a walking miracle because it's been about a year. How long did your recovery take?
That's always an ongoing thing, but because everything went so well at the hospital, I mean, and again, I was there very, very quickly. all the conditions were in place for a great recovery because obviously the symptoms were noticed immediately. 911 was immediate. We were close by to the hospital. We were at a stroke unit at the hospital. Everything went very quickly. So, you know, and I was able to get injected with TPA, which broke the clot up and got rid of the symptoms rather quickly. And I think that was kind of the amazing part. So I think really the recovery was started immediately, but, you know, even now there's a small ongoing little lingering things, but, you know, nothing to complain about. But given the situation, I'm, you know, certainly grateful that it happened the way it did.
So what would you say to people who want to ignore symptoms, especially men?
I've had this belief for a long time. It's like I think we all, either people young or people, men especially, I guess we tend to, are we going to tough this out? Or we tend to not want to go to the doctors. We don't like hospitals or doctors, that type of thing.
So what would you say?
And I just say this is, it's really bad thinking. I think people have to just realize that, you know, what's the worst that can happen if you go to the hospital or the doctor that, oh, we didn't find anything? Okay. You know, if you have a problem, you think there's something going on, I think you need to go. You never know what it is. And not all strokes are like this. Strokes can be just a massive headache. It just can be other things. So I think that, and knowing that, you know, it could be that way. I mean, the message is, you know, make a phone call, get to a doctor, get to a hospital. I think that just react. If you're having a problem with something, you know, that's important to
don't try to tough it out.
Go get help. Yeah, I think it really is a no-brainer. You know, we have all this health care available. You should use it.
So, well, we certainly appreciate you coming and sharing your story, because from, you know, being on the roof, going into basically paralysis and it escalating at the hospital, and now here you are being able to share your story. You just obviously had a lot more to do, Dave. It wasn't time.
That is definitely true. Guardian angels were on my shoulder that day because, and it was, things fell into place. So I guess I was very, very fortunate.
Well, Dave, thank you for sharing your story with us. I'm sure you've changed some lives, and happy anniversary.
Well, thank you. I was glad to come and be here. Thank you very much.
And we will be back right after this. Don't go away. When it comes to a stroke, remember the word fast. Facial problems, facial asymmetry, something drooping, numbness in the arm, slurred speech, and most of all, time. Don't wait. Time can make the difference between you being here to have healthy connections and people being sorry that they didn't encourage you to make that call sooner. We want you to be around and enjoy your healthy connections, so be smart and think fast. I'm Annetta Wilson. We'll see you next time.